Hello everybody and welcome back to What the Health with Dr. L, where I share with you brief evidence-based answers to important health and wellness questions. And today's question is, what can I do to keep my blood sugar levels under control? To answer this question, we need to understand the factors that lead to high blood sugar levels. Number one is a diet full of refined carbohydrates, like too much white bread, pasta, rice, pizza, cereal, candy, chocolate, sodas like Pepsi and Coke and Sprite and all that stuff, cookies, crackers. Number two is a sedentary lifestyle, especially during the winter season. People tend to be less active. That's why it's important to find ways to move a little bit more. Number three, too much stress that is not properly managed, whether it's emotional or physical stress. That's why it's really important to take the time to build resilience to stress, because there's no way we can avoid stress. Number four, some medications like steroids, cough syrup, cough droplets, decongestants can actually lead to elevated blood sugar levels. That's why if you have to, if you don't have to take these medications, stay away from them. If you have to take a remedy for cold, check with your pharmacist for something that doesn't have a decongestant. Or if you have to take something for cough, check for a cough syrup that is sugar-free. There are other things, that we all can include in our diet that help to regulate our blood sugar level. Number one is vinegar, and these are backed up by clinical research. Vinegar is great, whether it's white vinegar or apple cider vinegar. A lot of pickles, they have vinegar in them. It's always a good idea to include vinegar, find ways to include vinegar in your diet. Number two, healthy fat like olive oil, avocado oil, coconut oil. These healthy natural fats help to slow down the gastric emptiness, the movement of the food from our stomach to the intestines to get absorbed, and therefore they help keep the blood sugar levels down. Also, certain spices and herbs like cinnamon, turmeric, bitter melon juice, garlic is also great. I also found the cinnamon to be a great replacement for sugar. I put it in my tea. It's a great sweetener, better than sugar or any alternative to sugar. Also, taking a little walk after we eat helps to keep the blood sugar down. It's been proven to decrease postprandial glucose level, or after meal blood sugar level. So, and you don't have to go far. You just take a 10-minute walk is always a good idea, especially after a heavy meal. And also, there is a form of exercise called high-intensity interval exercise. It doesn't take much time, and it's been proven to be very effective in keeping blood sugar levels down. And the way you do it, you sprint for half a minute and you rest for 2 minutes. Go again, sprint again for 2 minutes, and rest sprint for 30 seconds or half a minute and rest for 2 minutes. You do this 2-3 times. I sometimes do it on the stationary bike. I get on my bike, go very fast for half a minute and rest for 2 minutes, 2-3 times. If I don't have a bike or a space, I just run in place. I run in place very fast for half a minute and rest for 2 minutes, 2-3 times. And I would like to end this video with just a word of advice to people who have been diagnosed with diabetes mellitus type 2 and taking medications. The medications you're taking are important to keep your blood sugar down, but they do not really resolve the main cause, the root cause for diabetes mellitus, which is insulin resistance. Because high blood sugar is a symptom, it's not the driving force. And what causes this insulin resistance is insulin itself. The insulin, the hormone the pancreas produces to open up the cells, to use up the glucose in the blood. Sometimes when we end up with too much food, we eat too much food and we are not moving much, the body cannot, the pancreas ends up producing more insulin to force that sugar inside the already full cells. Then that sugar gets turned into fat, in the liver, because there is no way we can use it, and that's why people with diabetes keep gaining weight. Now, whether you're taking metformin or glyburide or any other drug, that's fine, but if you keep taking that drug, you build up tolerance to that drug and you end up needing more drugs and you end up needing to be on insulin. And to avoid this vicious circle, you really need to think about ways to reduce your insulin resistance. These ways might include, you can discuss it with your treating doctor. Some people respond very well to intermittent fasting more than 12 hours. You stop eating at 8 p.m. and you don't eat again until after 8 a.m. You can build it up to 16 hours. And the intermittent fasting should not cause vomiting, should not cause stomach upset. People, ladies who might be pregnant or breastfeeding, or people who are underweight, intermittent fasting might not be a good idea for them. Also, another way, as we said, to cut down on refined carbohydrates, include fibers in your diet from vegetables and healthy fruits. Stay away from too much fructose you get from sweet fruits. Too much fructose is also not a good idea. And making sure that you include the things we have talked about, the vinegar, the cinnamon, and all the spicy herbs, and find ways to move a little bit more. All these factors, they have been proven to be protective against hyperinsulinemia or insulin resistance. Too much insulin and too much resistance to that insulin. I hope that was helpful. My best wishes for the best of health and the best of life, and see you next time. You guys stay well and stay safe. Bye-bye.